who needs that afterwards. And we'll have that recording available for anyone who needs it. The other thing is that because we do have so many people joining on the video feed, if we hear some background noise, we will sort of be checking and muting you. It's most helpful if you mute yourself and then just unmute when you're ready to speak. But please don't be offended if you hear the computer voice saying that we muted you. It just means that we might be picking up some background noise. And we want to make sure that everyone's able to hear as best they can. So with that being said, good afternoon, everybody. I am Helen Hockey, the Executive Director of the Pennsylvania Coalition for Oral Health, and I'm here today with some of our partners so that we can share with you the work that we've been doing on our adult dental benefit advocacy group. So the idea is that, you get to leave with a little bit more information about some of the things we've been working on. And hopefully, if it's work that you find interesting and you, want to learn more about in the future or join in with, that you're able to do that. So let me see here. Okay. And so as we move forward through the slides, you'll see that we have some information to share. We have a couple different people that have been doing the work with us for the last 2 years that are going to do some talking as well. So I won't have to be the only one talking all the time. But as I said, we'll have some time for questions at the end. If there's anything that you want to pop into and type into the chat box as we walk through, that's fine too. And I'm going to ask Amy, PCOH Amy, if you're able to mute some of these folks. I'm not sure. My computer's giving me a little bit of trouble. So if you see anyone's circles lighting up, please feel free to reach out and mute them. Okay. So as we start through here, and we'll have some time to introduce some of our partners too. But the partners on the call who are going to tell you a little bit more about themselves in a few minutes. We've got Vanessa Restovich from Achieva. We've got Monica Reyes from Berks County Community Health Foundation. Casey Wilson from Community Catalyst. Jennifer Wolf from the PA Health Access Network. And Jacob Hope from Put People First PA. And those folks will have some time in a few minutes to do some introductions. But just wanted to give you guys a little bit of that background. And what we're going to do is talk a little bit about the background of adult dental benefits under medical assistance, sort of how that's evolved in Pennsylvania, some of the national work that's being done across the country to improve benefits. Many of our states have varying levels of dental benefits. So, just to sort of give some of that lay of the land for everyone to understand. And then our team members will talk a little bit about the history of our work, and we'll go through some of the accomplishments and successes we've had over the last few years working together, and then identify some of our next steps and the struggles that we run into. The point is that we'd love to engage other groups and organizations who may have an interest in some of this work and might want to offer feedback to us, or do some more of the lifting themselves. But that's where we're sort of starting. So just a very brief, super high level background on this. I think, knowing some of the individuals and organizations that are on the call, many of you are probably fairly aware of the status of our adult dental benefits. But did want to give a little bit of information on that. So for those who may not be aware, back prior to 2011, our adult dental Medicaid benefit had coverage for, I would say, what would be considered more major restorative work, things like crowns and root canals, and if coverage for different prosthodontic work like dentures and partials, things that people would need more than once in a lifetime, they were actually able to get every so many years. And there was a process, of course, for things that wouldn't be typically considered an automatic benefit. They had something similar to more of what commercial insurances do now, a prior authorization, where you just had to submit the reasoning for the service, and then the individual insurance companies would determine if they were going to cover it or not. That changed back in 2011, where the state budget, they were trying to just trim some numbers out, and they landed on this number of, 30 to 35 million that they still needed to cut. And they realized that looking at the Medicaid budget, that the place that they could cut that would be to cut some of the major restorative dental benefits to meet their budget. So at that point, DHS, the Department of Human Services, which was then the Department of Public Welfare, issued a bulletin, a notice stating that the benefits would be cut effective September of 2011. So it was a little bit of a surprise. There wasn't a lot of fanfare about it. It was just sort of something they did. And since then, we've really been working on trying to establish the value for restoring those benefits, and for really something that's not a huge amount of the budget, that could mean a lot to a lot of people. So now our coverage under the adult dental benefits on medical assistance cover just our basic preventive and restorative procedures. So cleanings and fillings, and then enrollees are able to get one set of dentures or partials per lifetime. But services like crowns and bridges and root canals and additional sets of dentures and periodontal work, like the deeper cleanings, are now no longer covered. Patients are able to file what's called a benefit limit exception, a BLE, in order to get allowances for those things. But the BLE process is really meant for people who have a comorbid condition, of which, they have a medical condition that's going to necessitate their dental work to help them live. And unfortunately, they're don't always consider losing a tooth something that's going to, be a comorbid condition. So we end up seeing where people are choosing to get extractions covered rather than, paying for other services out of their own pocket to save teeth. So we've sort of looked at the last 8 years, and we've done some work around some analyzing of what people are affected, how people are affected by these things. One of the things that's been a major issue, and we've seen it come up in a lot of different environments, is when we do community surveys and we look at the hospital systems and their community health needs assessments, we see that oral health gets pointed out as a problem in different regions, sometimes as a top 5 problem, sometimes as a top 3 problem in communities. So we know that individual populations in Pennsylvania are affected by this, and it's one of the reasons that we work so hard to try to restore these dental benefits. So that's just a very high-level amount of background. I'm going to ask Casey Wilson from Community Catalyst to assist on the next slide here. We're going to talk a little bit about what the national picture looks like around this work. Casey?
Thanks, Helen. So hi, everyone. Thank you for allowing me to be a guest on your call. As Helen said, I'm with Community Catalyst. We're a national nonprofit healthcare advocacy organization. We provide support and technical assistance to advocates across the country. And I'm a policy analyst on our dental access project, so I work closely on oral health. So as part of that, I have had the pleasure of working with Helen and PCOH, as well as the other partners involved in this work in Pennsylvania through our work with OPEN, the Oral Health Progress Equity Network. I know Helen's going to talk a little bit more about that on the next couple of slides. So I and Community Catalyst got involved to provide some advocacy support to the grassroots advocates in Pennsylvania. So that's how we plugged in. As you know from what Helen has said, this group has been working on expanding the Medicaid adult dental benefit in Pennsylvania, so that's the work that we've been supporting. And as a national organization, we also support other states and have some sort of national level perspective. So just wanted to highlight really that the work that's happening in Pennsylvania right now is very timely. So expanding dental benefits, particularly for adults in Medicaid, is something of I guess I'd call it a hot issue right now So many states are working on establishing a dental benefit for adults if there isn't already one in their state Medicaid program, or expanding on the one that exists, similarly to what Helen and other folks in Pennsylvania are doing. So just this past legislative session alone, in Delaware and New Hampshire, dental benefits were successfully added to Medicaid. There were improvements to benefits or some additional funding allocated in Vermont, Virginia, Colorado, and Kansas, and increased benefits for certain specific populations in Colorado, Utah, Nevada, and Washington. And so that includes things like coverage for pregnant people under CHIP, coverage for some low-income seniors, coverage for some folks with diabetes, things along those lines. There's also some federal level work happening around adding dental coverage to Medicare and including dental benefits in a variety of different federal proposals for universal coverage. So there's a lot going around both at the federal level and also in different states across the country to improve access to dental care. So all this really is just to say that there's a lot of momentum around this issue right now. So it's really a great time to get invested in a targeted campaign. And also that there are resources available and experiences from others who are working on similar campaigns around the country to draw from. So obviously Open in general is a great resource, and Helen will talk more about that. But specifically, there's a learning collaborative that meets monthly through Open, and that consists of state and local advocates who are working on expanding their Medicaid adult dental benefit in their state. So that's just one specific source of experience and expertise, and there's a lot of resource sharing that happens in that space. So just wanted to flag that, and I will turn it back over to Helen to talk a little bit more about Open and about the work in Pennsylvania.
Thank you, Casey. Yeah, and it's actually a really good thing. I think that, you know, Pennsylvania's been fortunate to be part of some of the national work that's happening around these things. So, you know, we learn from each other, we learn from other states. You know, more recently, Maryland had some success with using their emergency data numbers to really push their legislature to add some dental benefits. And, you know, things like that, you know, if we're in a situation where maybe we don't have the exact data we need, you know, using those Maryland data can help us sort of push some of these initiatives forward. So as Casey mentioned, it's part of the Open Network that we have this national call around adult dental. And for those that aren't familiar, I did just have 2 slides to give you some background information. It's a group of oral health advocates from across the country. We have a platform that we use to communicate online, and we share our resources. But it's a really kind of great place to go when you need resources. And they've got, I think you're actually closer to 1,800 individuals as part of the Open Network at this point. They do fund some projects. They do, you know, work as consultants with some different organizations. And anyone is welcome to join the Open Network. So I have the website up there, the www.oralhealth.network up. And you just request a username, and then you can get in. There are state-specific pages. There are also specific pages to the work that, you know, you might be interested in. So maybe you're not only interested in adult dental, but you're also interested in adult and Medicare, or you know, increasing kids' access to dental services. There's sort of different pages for everybody on that. So have to mention the Open Network in this work, because it is one of the reasons that all of our partners have come together. So with that, we'll talk a little bit about our partners. I'm going to go ahead and have each of our partners, main core partners that work on this stuff, go ahead and introduce themselves. So Vanessa, I'm going to go ahead and call you up first if you are able to unmute.
Yep, I think, do you hear me?
Yep.
Okay, super. My name is Vanessa Restovich. I'm with the Disability Healthcare Initiative at Achieva, the ARC of Greater Pittsburgh. Oral health care it seems like a strange topic for a disability agency to take on. However, we know from our long range experience with families and folks experiencing disabilities that dental care is and remains one of the most difficult aspects of healthcare to access for folks with disabilities. And it's always the combination of, you know, some people may experience the dental provider shortages in a certain area, or not accepting Medicaid or insurance, or simply not an inclusive practice somewhere in your area. So people with disabilities usually get hit with one or all of those things. And so whenever, so a shortage hits folks with disabilities especially hard, and usually it affects them first. So we've been doing this work for about 15 years, and we've had, at first we took on some chunks of it and had some successes there, and had the Legislative Budget and Finance Committee commission a study on dental care and disabilities, and had some other policy successes in the legislature. However, the cuts in 2011 really hit folks with disabilities hard. They obviously need more than just minimal routine dental care. One set of dentures per lifetime isn't enough for even usually a typical person, but a person perhaps experiencing intellectual or developmental disabilities isn't a good candidate for dentures, because it's difficult to get the bite correct, and they often need implants instead. And what we find is that for folks with disabilities, there's a real rush to just like pull all the teeth and you know, slap some dentures in, even if that's not really the most helpful thing to do. They need more routine cleanings and things like that. So when the benefits were cut in 2011, it hit folks with disabilities very hard, and it's not enough coverage for them. So that's why we've been working on this issue. We work very closely with PCOH on this, and we are a member of the Open Network as well, one of the grassroots organization members, and we are committed. I mean, we've been at this for 15 years, so we're committed to restoring benefits for the folks who need it.
Thank you. I'm going to ask, going in order of my slide here, I'll ask Monica to speak next. She's going to talk a little bit about why the Berks County Community Health Foundation has gotten involved in this work.
Thank you. So my name is Monica Reyes, and I'm the Health and Human Services Program Officer here at the Berks County Community Foundation. We started getting involved. We don't really do much of the programming or advocacy work through our organization, and focus mainly on the management and disbursement of grants in the local community. We only approve grants countywide, so most of our work is in Berks County. We started getting involved with the dental work. We helped the two major hospitals here in the county do the community health needs assessment, and as Helen mentioned, dental care is one of the issues that it always comes up in the health needs assessments. And unfortunately, there are other issues that hospitals tend to work on, like mental health and obesity, which are very important. But throughout the years, we've noticed that the hospitals haven't really tried to address the issue in the county. So we started a task force made of providers and dentists to try to address some of the barriers associated with dental care. And after realizing that we needed more community input, a larger task force was created. And this task force wanted to focus on children, knowing that when children learn healthy behaviors when they're younger, that can often lead to better healthcare outcomes in the future. But the reason why we're involved in this initiative for the adult dental benefits is because there is a strong correlation when an adult parent doesn't have insurance. They're very less likely to take their child to see a dentist. And it's also a lack of knowledge or education, and if they don't have dental insurance, they don't think that their child has dental insurance. And as we know, children are covered by the CHIP program, but it's underutilized because the parents don't have dental care, so they're less likely to take their kids. So I offer a different role, I think, from the other partners in this group, that I'm not solely focused on adult dental benefits, but with the work that I'm doing focusing on children's dental health, I do see a correlation and a strong connection with addressing the issues that are affecting adults. So I'll play a somewhat different role in this group, and I don't participate in all of the phone calls, but I am kept up to date with the nodes, when the meetings will be coming up. So when I'm looking at the agenda and I feel like I can participate and help the group out, I attend those meetings and have participated in a couple of legislative outreach initiatives that this group has done, and also providing local data to help the initiative move forward.
Thank you, Monica. Next, Jennifer from FAN.
Hi, everyone. Can you hear me okay?
Yep.
Great. So thanks, Helen, for having me on and for letting me take the time to talk a minute about our organization and why dental benefit is so important to us. My name is Jennifer Wolf, and I'm a policy analyst with the Pennsylvania Health Access Network. If you're not familiar with us, FAN is a nonprofit organization that was created in 2007. We enroll about 10,000 folks in coverage per year, and we enroll folks in about 61 out of 67 Pennsylvania counties. So we're very widespread across the Commonwealth. And if you know anybody in those other 6 counties who needs to be enrolled in health coverage, please give us a call, because we would love to say that we have 67 out of 67 counties in Pennsylvania. But more than half of those enrollments are in Medicaid from across the state each year. So FAM was really involved in Medicaid expansion and bringing that to Pennsylvania. But even prior to that, the dental benefit has been one of the top benefits in our minds for all of consumers. FAN was around when the cuts were instituted in 2011, and we saw a lot of folks lose access to really important care. We've also been increasingly concerned about the benefit limit exception process that Helen mentioned earlier. We know that our navigators who have been working with folks to access coverage and assisting folks in that process have had pretty low rates of approval with that exception. And so we're really concerned about folks who are needing access to care, especially with the exception process, and just aren't getting it. We know that a comprehensive dental benefit keeps folks across the board really healthy and able to work. So we're able to see a lot of ways in which it affects folks not having this benefit installed anymore. In order to gather information on how this affects folks, FAN has actually pulled together a mini campaign outside of this campaign called the My Teeth Matter. And we use it as a platform for consumers to be able to share their stories and the problems that they've experienced with oral pain in both Medicaid and Medicare, and not having the ability or access to relieve that pain through the adult dental benefit. We've also gathered folks to sign a petition and have reached out to, for folks to take a survey that we've created to see how this lack of benefit has been affecting consumers. And we've collected a really good number of stories throughout this survey and some really good information on why this benefit is so critical to Pennsylvania consumers and why we should be really working hard to have it restored so that folks can get access to dental coverage. If you are interested in taking the survey or sending it to folks that you know of through your organization or partner organizations, we'd be very happy to send the survey to you to have it taken. So if you can let me know or let Helen know after the call, we'll absolutely be able to send that out to you and get you some assistance with that. And I guess I'll say one last thing, that we know that this campaign is really specifically focusing on medical assistance or Medicaid, but FAN has really seen this issue, and we see it's a very important issue for folks across the board with any type of insurance. And we've been hearing this consistently from navigators and activists that we work with, that this is a really important issue across the board. So we're really excited to be on this campaign with Helen and other folks, and hope that we can really work hard to get this benefit restored.
Thank you, Jennifer. Jacob Hope from Put People First. I know he's going to come back on video there.
Yeah, sorry, I'm on video on my phone, so I didn't want it moving around and distracting everybody. Yeah, hey everyone. So yeah, my name is Jacob Hope. I'm a member of Put People First Pennsylvania. We're a grassroots statewide organization fighting for healthcare as a human right. And so we're a member-based organization, and so the things that keep coming up for our members and that we know is an important part of people's right to healthcare is people's dental care. So what we've been doing is been taking action on people's struggles. So multiple times across the state, people have had issues with their dental care and who have Medicaid getting their BLEs approved. So one thing recently, just for one example that we've done, is we pressured a dental insurance company to approve a BLE for someone who was originally denied, and she actually later was approved after we went to the press and did a call-in day, and NPR, WHYY, our local NPR station here in Philly, did an article about her, and then that's why she was approved, basically. So we're not like a nonprofit. We're like a community organizing grassroots organization, but we do think that action is important and organizing around those stories is important. Individual wins are important, but also we do think like we need to expand the adult dental benefit. And so when people have problems with BLEs, we take action around it, not just to get person the win that they need, but to like highlight this issue because we know that Pennsylvanians all over are struggling with it. So and we also do table at places like Mission of Mercy. So Mission of Mercy is a free dental clinic that travels across Pennsylvania. There's a couple every year and hundreds, if not, when we table at it, we talk to like 100 people who had insurance, actually had insurance from their job, but not dental insurance. So a lot of people, to what Jennifer was saying, are not getting the dental care they need. Many are on Medicaid. Many others are unfairly denied by Medicaid or are undocumented. And then many others have work insurance, but doesn't cover their dental. So yeah, adult dental benefit is like a big issue. And yeah, dental care in Pennsylvania is very important. So that's why we are like, it's one of our core campaigns for healthcare as a human right. So happy to be on this coalition.
Thank you. Thank you all for taking the time to share some of that story with those on the call and for those who may watch it in the future. And PCOH, just as a little bit of information for those who may not be as familiar with our background, is that we have, of course, focused on oral health as a priority since we were formalized as the coalition in 2013. But one of our main priorities and goals throughout the last 5 or 6 years has been, to lift up the restoration of adult dental benefits to help the people that are most affected by dental disease. Because for those who may not be aware, we know that 80% of dental disease occurs in 20% of the population, which would be low income and minority populations. And those folks are more likely to be seeking medical assistance for their dental benefits. So it's really, really important and really vital that we can get these benefits restored so that people have the best chance to stay healthy for a lot of the reasons that our partners just mentioned. So as we move forward, we're going to talk a little bit about some of the successes that we've had over the last 2 years. This group, through some funding through the DentaQuest Foundation, was sort of formalized as a partnership back in 2017. We started working together, trying to sort of pool our resources and our people and try to make some real movement happen around the adult dental benefit. So, and I apologize, this text is a little bit small, but I'll say that it's because our successes take up so much space that, makes the font small. So, with that, we held our first advocacy day back in June of 2017. We gathered some individuals from our groups, as well as we had a public health dentist from one of the local federally qualified health centers come. And we spent all day in the Capitol. We met with legislators and we met with the budget administrators to really start making the case for restoring the adult dental benefit. Another project that sort of came out of this, and when we call it an unintended consequence. And for those who have talked with me about this in the past, you know this story, but I think it definitely bears mentioning that when we look at the dental schools across the state, Pennsylvania has 3 full-time dental schools, and then we have a dental school up in Erie that is a branch of LECOM, where 4th-year dental students come and spend the last year of dental school. But one of the main ways that these dental schools get the patients for their students to work on and to meet all of their accreditation standards is through folks who are enrolled in medical assistance. So, prior to 2011, the patient base for these schools was coming from people who are on medical assistance, and they would come in, and then these dental students could practice crowns and root canals and get all of their requirements needed to graduate. So one of the things that has happened with some of the schools at this point is that now the patients are still coming in and they still need those services, but because their insurance is not covering it, dental students have to give them a backup treatment plan, which typically includes extractions. So rather than getting their tooth root canaled and crowned and being able to keep it, they have to recommend an extraction for that tooth because it's the only way to remove the infection from the patient's mouth that's covered by their insurance. And so since then, some of the schools have had to actually pull back on some of their requirements for graduation. Simply because the patients aren't requesting the services any longer because the insurance doesn't cover it. So, we've seen numbers that show that things like dental students having to used to maybe have to have, anywhere from 8 to 12 crowns completed to graduate are now being reduced down to about 1 to 2 crowns to graduate. Which then has a lot of long-term effects for the Commonwealth because we're maybe putting out a workforce that hasn't had as much time to become proficient at their skills. And so that's something that, we've approached with the legislators because it's definitely a problem that's going to affect everyone in the Commonwealth. So we've sort of gathered some data and some numbers from the schools on that and used that information to demonstrate the unintended consequences of the cut. We've also looked at some emergency department data, and I'm going to ask Vanessa to speak for a minute on that, if she would be so willing, so that we can talk a little bit about some of the numbers we looked there.
So we haven't had a lot of luck getting the best data on this from the state. They have tracked it a bit, and they got basically some crude data to us, covering all of the states or the counties across the Commonwealth. And basically, what we've seen is a jump from 2010, before the cuts were instituted, and 2014, right before the Medicaid expansion, and we also looked at 2016 after the Medicaid expansion. So we expected to see a jump in emergency room use rates for non-traumatic dental, certainly after Medicaid expansion. And we did see that there was a modest increase. However, it was very clear, especially in some of the more rural counties, that between 2010 and 2014 there was quite an increase in emergency room use for non-traumatic dental. In Allegheny County alone, the increase before Medicaid expansion was nearly 20% in use and in costs as well. Some counties across the Commonwealth have jumps as high as 400%. Across the state, across the Commonwealth, from 2010 to 2016, the increase was actually on average about 60%. So basically, when we took away that that more robust dental benefit, and combined that with folks who hadn't been getting any dental treatment before, and then were able to finally get some coverage under Medicaid expansion, basically it had the effect of just literally driving those folks to the emergency room. And I know that in our work at Disability Healthcare Initiative at Achieva, we worked on other projects with emergency room physicians, and so we know that anecdotally, emergency departments are seeing dental cases every single day, every single shift. Emergency departments aren't a place traditionally where someone can obtain definitive treatment for dental issues. So they still need to see a dentist after that. So it's really has been a Band-Aid approach to the problem that costs more money than it needs to. We would like to see folks get appropriate dental care from a local dentist. So that's one of the things that we're working on. We're trying to get better emergency room data to see just how much folks are using the emergency room for non-traumatic dental. We also know from the Medicaid expansion report, I think it was the 2016 report, that non-traumatic dental is lumped in with digestive disorders when they're seen in the emergency room. And digestive disorders are one of the top 5 reasons for being seen in the emergency department for both the Medicaid expansion population, but also the non-expansion population. So we don't have a way to carve out how much of that is actually dental, but it would seem that a pretty good chunk of it should be. So again, kind of anecdotally, because that's all we have, we know that that the cuts have created a serious issue. for our emergency departments. And you know, we know that they'd rather be freed up to see more serious medical problems than non-traumatic dental. So we'd like to get better data on that. And that's one of the things that we've been working on.
Yes, and that's something that, you know, we have reached out to a lot of the different organizations about how to get better data. So, and we'll continue to do that. Many of the organizations on the call today were part of our sign-on letter that we drafted late last fall, asking the governor and the assembly to restore the adult dental benefit. So that was something that we were able to get a pretty good amount of support around. And we shared that fairly widely, which has resulted in a lot of new contacts and a lot of increased conversation around adult dental, which has been really, really helpful. Earlier this year, I was going to say maybe that was late last fall, but I think it was earlier this year, we finalized a survey that we published as well. It was really designed to collect information on emergency department use, you know, to find out if individuals that are enrolled in Medicaid are you know, using the emergency department as a dental office, or, you know, if they see that as a possibility or an option, you know, and then when they do go there, are they getting it, you know, what kind of palliative care are they getting? Are they getting strong referrals? You know, and what does that say about their lack of dental access, you know, to a dental home? And just, you know, real quickly, of the, you know, we've received, I think, around 200 responses so far. Half of those individuals were individuals enrolled in Medicaid. What was very interesting, you know, when we asked about, you know, if they'd had a dental emergency, you know, how many times have you gone to the ER? And we found out that almost 10% of them had used the emergency department as a place for a dental emergency. And only 22% had never experienced a dental emergency. And then we also asked a little bit about recurring visits to the ER, because that seems to be something we discovered from our friends in Maryland. They had, you know, different stories of folks who had gone to the ER up to 34 times for one tooth in a year. And so that's a really big problem. So, and we did have about 10% of our respondents that had gone to the ER for dental pain said they had gone at least 2 to 3 times, and then almost 4% said 6+ times. So what we know is that individuals are going. It's not a huge amount, but there are people going to the emergency department numerous times for the same tooth because they're just getting palliative care, and they're not really getting any kind of treatment for their dental pain. Of those who answered that they had been to the ER for dental pain, 26% were prescribed opioids for their tooth pain. So those are some of the initial numbers we're looking at. That survey is going to continue to roll out. And if you have direct access to people enrolled in Medicaid and you'd like the link to share it, we can provide that as well. Jennifer, any other comments or anything? I know FAN is sort of housing that survey right now.
Yeah, I think you hit most of it, but one thing I just will add for a little bit of an additional history lesson is that in 2011, when the state limited the dental benefits, they also limited a pharmacy benefit. And about 2 years after they limited that benefit, they restored it because costs went up and people got sicker, and they realized that without that benefit, when that benefit was limited, folks were using the emergency department more and the costs were going way up. Unfortunately, while they restored that pharmacy benefit, which was great, they didn't restore the dental benefit at the same time. And here we are in 2019, still fighting to restore that benefit. So thanks to the survey, we know that the same is true with folks who have lost this adult dental benefit, right? We know that dental is really important, not just to oral health, but to full physical health. And that it's still seen as an optional benefit, but folks really need it in order to be healthy and lead productive lives. And so I think we really need to think about innovative ways to be restoring the benefit, working with managed care organizations, working with community-based organizations, and really showing folks that this is a much needed benefit that needs to be restored.
Absolutely. And then just a little bit more information through all of this time frame as we've been talking. We have had numerous meetings, with the Department of Human Services, Office of Medical Assistance programs, specifically with Deputy Secretary Kozak. And they have done some adjustments to the BLE process, which has been great, including, putting the form to be available online, helping to reduce the requirements to file a BLE, such as a medical physician's signature, some of the red tape that was just sort of holding things back. And we're expected to see a bulletin come out towards the end of this year addressing some more of those things as well. Just as, as a sort of side project of this, and those who are more familiar with PCOH may be aware of this already, but we've also been documenting the need in our state. So we've been looking at all of the dental services that are provided free of charge through free and charitable clinics or pop-up clinics or groups like the PDA, the Pennsylvania Dental Association, Give Kids a Smile Day. And we're just looking at the need that's being documented. So it's a pretty recent project for us, but just since May, we've had 19 respondents fill out our survey from organizations that provide free dental care. And just from those 19 respondents, we've now gathered that in 2018, more than $4 million in free services were provided to individuals in Pennsylvania. So we're expecting that number really to about double if everybody was filling out the survey. And we'll continue to track that hopefully on an annual basis so we can really keep track of the need in the state. And that led, sort of as a direct result from our second advocacy day we had last spring, and we really talked with some of the legislators, and of course they want to see numbers and they want to see the data that are proving that people are suffering. So that's sort of what we're working on, and now doing a lot of follow-up with individual legislators. So if someone on the call wants to say, hey, by the way, I have a great relationship with so-and-so, or I'm going to be going there next week to talk about this, could you give me some resources so that I can mention this adult dental stuff as well? Those kinds of things are really, really helpful. And I think the more people we have in the ears of the decision makers, we're going to be able to get more traction. Something that I see as a win for those who may not be aware, just recently, about a month and a half ago, the Department of Human Services announced that they were going to be requiring managed care organizations to track adult performance measures. So, how often are adults getting to the dentist who are served by MA, as well as measures for women, pregnant women as well. So we're seeing some interest here, and we're starting to see things move forward. And it's actually very exciting, but we still need a lot of help, and we still would love a lot of support from other organizations to help kind of continue this momentum. So looking at that, some of the main key points, and I'll just take a minute to talk about this, is, we've made all these connections. And what we hear from a lot of people is this is a really, really important thing, and we totally understand, but we just don't have it in the budget, or you should talk to this one, and then you go to this one and they say you should talk to that one. And a lot of people are just kind of kicking the can, and we really are at a point now where it's time to go ahead and say, okay, what do we need to do to cross the finish line? And that's something that, our group is working on collectively, and we would love any input on that as well. As well as looking at better figures on emergency department use. Because our state does not require the hospitals to track if a problem is a dental issue, searching for codes, for dental doesn't really give us the true picture. And then quantifying, obviously anything you make as a legislative change must have a fiscal note. How much will it cost our state? So quantifying that is very difficult. How do we know if we were originally supposed to save $30 million a year by taking this benefit away, but now we've grown through Medicaid expansion, and we've also allowed problems to get worse for 8 years. So, it's really hard to make a good fiscal note that could go accompany any kind of work with this. But those are our sort of next steps and things that we're looking at. So with that, I did want to allow a few minutes if anyone wanted to unmute, or if any of our presenters want to add any last comments, as we're trying to be mindful of everyone's time. So I'll pause there for a second and see if anyone has any ideas or comments or questions.
Hi, this is Chad Kraus from the Pennsylvania College of Emergency Physicians. Thanks again for inviting us to participate in this call. Certainly, I wanted to add a few other comments to the discussion about emergency department use as a practicing emergency physician and on our organization's board. It's certainly difficult to get good data about particularly dental issues in the ED, and that's been a national challenge as well, not just in Pennsylvania. But we certainly probably could talk offline about maybe some other strategies for capturing at least some of that data. And then the other comment I really wanted to make, and our organization, I think, is really excited to be a part of this conversation. But the other comment I would make is there are really several parts of the ED usage for dental complaints. You know, one is certainly coverage, which is expansion of benefit, but the others really are access, which is probably equally, if not more important. And the access isn't necessarily just at the point of need. So when I wake up at 3 in the morning and the tooth that's been infected for 2 weeks is now throbbing really badly, and the only place I have to go is the ED. But also then once in the ED, what's available to us is very, very, very limited as far as where to refer these folks for additional treatment. And as mentioned, many times, unfortunately, these folks are just referred and get an extraction rather than, you know, whether it's a crown or a cap or a root canal or some other definitive treatment. It's really just extraction, which may not be the optimal treatment. So I think that's a particular problem, and especially in rural parts of the state where there, number one, just aren't a number of dentists, and number two, of the dentists that are there, many either don't accept or limit their Medicaid panel of patients. So I think there's multiple sort of inflection points at which we might address it. But I would anecdotally say in the past 7 or 8 years, the number of dental visits has increased, and probably the frustrating part for us as emergency physicians isn't really that these are not emergencies, because they certainly are emergencies when someone has an abscessed tooth at 2 in the morning, but really that people don't get the care that they need. And we don't have a whole lot of adequate ways to handle it other than giving them antibiotics. And in certain cases, because these folks are showing up in a sicker state, you know, they need to have imaging then, because now we're concerned that the abscess has eaten into the bone of their jaw, et cetera. So it's really frustrating because the folks aren't getting the care that they're entitled to, I think.
Thank you. Thank you for that comment. And I did fail to mention one of the things that we talk about with the access piece is that, you know, it's really hard to get more providers to take MA when you don't cover anything on MA. So that goes hand in hand, that once the benefits can be extended, then, you know, it's much easier ask a provider to participate with medical assistance when they can actually treat the patient the way that they've been trained to. So, but yes, we will definitely be reaching out, because that's been a missing piece for us for a long time. Any other comments or questions? Giving everybody a minute, because I know coming off of mute sometimes is difficult. I'm not seeing any other boxes light up. So feel free to interrupt me if you're still coming off of mute. But, you know, one of our next steps is, you know, we will put this out and we're going to, you know, let everybody know if you're able to and you're not receiving information from us already about this. I think we do have a pretty good handle. Did anybody not get to mention that they're on the call if they called in and maybe we're not sure what organization you're from? I just want to make sure, you can always type it into the chat box too, but I want to make sure that we have contact info for anyone who's joined us today. And we can send out a link to the recording so that if you need it for a resource or you need to share it with any colleagues, we'll have that available for everyone as well. So anyone else need to just give a quick intro or anything like that before we finish up? Okay, and as I said, I think we have a pretty good handle on the folks that were able to join us, so we can make sure we get a hold of everybody that way. And if you don't hear back, obviously you can get a hold of the coalition at any time, and we can certainly meet up that way. So I will go ahead and stop the recording now. And thank you so very much, everyone, for joining.